Hello, everybody.
Hello, welcome.
I am Richard Del Monte. You are?
I'm Angela Wright. Last I checked.
We welcome you to this edition of our webinar series where we talk today about Medicare planning and all you need to know if you're a 64-year-old. This is part of a series of webinars that we are doing to discuss issues that are really relevant to all people who are getting into retirement age or, coming up on in accumulating wealth, distributing wealth, all that stuff. So thank you for being here.
Yep. If you aren't familiar with us already, I am Angela Wright. I have been a financial planner for 20 years now with a focus on helping folks plan for retirement. And once they're there, ensure that they don't run out of money and solving all of the little issues that they have throughout their retirement years.
Right. And I'm Richard Del Monte, and I founded the firm about 37 years ago. Hate to date myself, but what are you going to do? And, and we are a small boutique wealth management firm, a discretionary fee only firm located in Alamo, California. And our claim to fame is that we provide creative, out of the box solutions for the financial problems that our clients have. And we get some doozies and we love them. So bring them on.
Yep. And the more complicated, the better, in my opinion. And one of my favorite things to do is to watch Richard solve these things in real time on a yellow pad. If you've never walked, not calling you old, I'm saying, there's this vast knowledge and creative problem solving ability. And I think our clients really love it.
We have fun.
Yeah. So should we get into it?
Yep.
Let's do it. Give me just a second to get our slides going here. As always, important disclosure information. This webinar is for educational purposes only. Please talk to your own advisor before making any choices about Medicare, and past performance is never a guarantee of future results.
Our objectives today for this webinar are, when you leave, you're going to be able to understand the who, what, when, where, and why of Medicare and how to enroll and when you should do it. We're also going to help you understand how to combat these sneaky little price increases that they have in Medicare premiums based on your income. And that's a big one. And we're also going to help you understand and avoid the penalties that exist if you don't sign up for Medicare in the right time frame, and what to do if you're still working at your job. And if you also have private insurance, what to do about that when you turn 65.
It's a tall order. Let's do it.
Lots to cover.
Let's start by talking about who provides healthcare insurance to the population in the United States. Well, more than half of us are getting our insurance through our employer, right? Get a job, totally. Get your healthcare.
Yep. Cradle to grave.
Well, not necessarily. That's what we're talking about here.
Cradle to 65. That's right.
Exactly. A little less than 20% of us are getting our insurance from Medicaid. Those are our low income folks. A little less than 20% are on Medicare. That is what we are talking about today. Those are our folks over age 65. About 10% of us have individual policies that we're paying for. Those are through things like the Obamacare, the Affordable Care Act, or private insurance. And then a little more than 2% of us have VA veterans benefits.
So let's talk about making the transition from your employer's health insurance plan to Medicare. Medicare is the major health system in the United States for people over age 65. All private health insurance is built around the fact that when you turn 65, you will enroll in Medicare at some point. And if you're retiring before you hit age 65, you have to enroll in Medicare when you get to 65. And if you're retiring from Medicare, retiring from your job after you hit 65, you have to enroll in Medicare then at that point, at the latest.
Right. So Medicare has all these different parts, like this alphabet soup, A, B, C, D, Plan G, L, F. I actually think it's awful that the most important, I would argue, decision that a retiree is going to make is so complicated.
Yep.
And our retired population, we were slowing at our capacity. Like, these are not the people to make it complicated.
That's right.
Sorry, but
don't make it hard for them. Right.
So essentially, I want you to think about this like you have two paths on Medicare. Choose your own adventure. You have original Medicare. That's Part A, Part B, and you can add Part D and Medigap to that. Part A is like your hospital insurance. When you stay in the hospital, you go to the emergency room. Part B is like doctor visits and, your regular care.
Right. Those of us that have been around for a long time, hint,
I don't
older.
say anything.
See, I know, but there used to be a thing called indemnity plans where you just went to any doctor on your health and your health insurance would pay for it. Now we have, PPOs and all those networks and stuff. But original Medicare is like no networks. You just go to any doctor that's on Medicare, anybody in the country. So it's kind of old school, based in 1965, and it hasn't changed since it was invented, really. So
Yeah.
that's the difference in it. Something that younger people have no idea how
I
they
have no idea what that's like.
Yeah.
No clue.
Yeah.
Okay. So the other adventure you can take is called the Medicare Advantage Plan. This is Part C. So you either get ABD or C. And on Part C, sometimes you have to add drug coverage. So sometimes you're going to add a Part D to that on Medicare Advantage Plan.
Right. So it kind of mimics what you have at work. Kaiser is in there as a Medicare Part C, Blue Cross, Blue Shield, but they have PPOs, copays, deductibles, networks.
Yes.
Yeah. Let's talk about some stories to give you some insight into how this works. Donna is a fictional person, but fictitious, and she retired in 2009, and she actually turned 65 in 2011. She had individual Blue Shield coverage that she was paying $800 a month for it, and it had a $1,500 deductible. She knew nothing about Medicare. Classic, right? And most people don't.
Yeah.
So what is Donna's path to Medicare? What she had to do was she had to decide on what kind of supplemental insurance to get, whether she should go with the Medicare traditional or Medicare Part C. She also had to choose a drug plan. And she had to finally enroll in Medicare at least 3 months ahead of time. Well, 3 months ahead of time before she turned 65. And the planning process takes a while, especially if you're working somewhere. You have to be able to go and talk to your employer and stuff and get information in advance so you know what you're doing. So we recommend that people start planning for Medicare 5 months before they turn 65.
Yep. So now let's talk about our friend George here. He retired and turned 65 in the same month, March of 2022. He opted for Medigap to get guaranteed issue during the 6-month enrollment period. So I think this is a really important point we need to stop and make here, right? Medigap requires insurability. If you do not sign up for it within the first 6 months, which is your guaranteed issue period,
right?
You can sign up for it right when you sign up for your A, B, and D. You must sign up for it within 6 months to get that guaranteed enrollment. Now, George is an interesting fellow. He's the guy who likes to poll all of his friends all the time. What are you doing? What are you doing? What are you doing? Well, guess what?
Poor George.
Poor George.
Social creature that he is.
So all of George's friends have Medicare Advantage, and they're talking about their free gym memberships and
dental.
Yeah, they have dental included. And George is starting to do the math, and he's going, wait a second, I'm paying way more than my friends, and they get to go to the gym. So 1 year later, he switches onto a Medicare Advantage plan. Oh, shoot.
Bummer.
George loves to travel all over the United States. In fact, his 5 kids all live in different states, and he developed some eye issues. And so now he requires daily meds and specialist visits. And he is totally different medically than he was prior to joining the Medicare Advantage plan. Now, he's in a pickle, right? Because every time he goes to visit one of his children, he's out of network, right? With most Medicare Advantage, like I've got my local network of doctors here in California. When I'm in Boise, Idaho, my doctors are not there. So he's looking at out of network cost if he has to see a doctor there.
Mm-hmm.
And his medications are very expensive on this plan. So luckily for George, you have 1 year to change your mind. I know we told you it's 6 months, but you have a year to change your mind if you enroll in Medicare Advantage, and you don't have to qualify to go back to Medigap. If he had waited 366 days, he would have had to qualify medically. So luckily George is okay. He made it back onto Medigap.
And the vast majority of people do not qualify medically if you're 65.
Correct.
To go back. Yeah. Let's talk about the difference between Medigap and Medicare Advantage plans. So AB plus Medigap, they're going to have higher premiums but they don't have any copays. As I mentioned before, this is like the old traditional indemnity plan. It costs a little bit more per month, but You basically don't get any bills. You don't get any statements. Nobody sends you any kind of asking for money. You're done. No referrals are necessary to go to a doctor. If you get sick and you want to go to Memorial Sloan Kettering in New York City or the Mayo Clinic, you can go. You don't have to ask anybody's permission. You're covered. Medicare Advantage, on the other hand, generally has lower premiums, but it also, you got networks to deal with. You got to get permission many times to go see a specialist. You do get extra benefits, as Angela said, vision, hearing, fitness benefits, etc. And they usually have a drug plan included in it, not always.
So let's talk Medigap options. I know I told you you have A, B, C, and D, and then guess what? We go a layer down into Medigap, and now we're back in the alphabet, and you get to choose another A through N.
Right.
with some
Lucky
letters,
you.
with some letters missing in between.
Yeah.
So I'm going to make this really easy for you. Plan G is what you want.
Yep.
Most of you, by and large, Plan G is what you want. It has the most coverage for what you can get here.
Right.
Reasons you might go outside of Plan G are mostly financial. It is going to be the most expensive one. And so you might have to make some concessions if you can't afford it. However, on average, what's the average Part B premium?
$135, $150 a month.
Supplemental premium. I almost said that wrong.
Yeah. Medigap. Yeah.
Yeah. So you're looking at about 135. Most people can afford this, and it's what you should do.
Yeah. Yeah, definitely. The only thing you have to pay is the $233 deductible for Medicare.
True. No matter which one.
That's all you have to pay. After that, everything's covered. It's about as cool as you can get. All right. Considerations that you need to bring to think about. You have to decide between original Medicare and plus Medigap and Part D, or going into a Medicare Advantage plan.
And the time to be thinking about this, by the way, is when you're 64 and a half.
Right.
64,
Way
yes,
advanced.
and 7 months. You can start thinking about this.
Definitely. Definitely. Okay. We already covered Medicare Advantage. You're going to also need a supplement to go with traditional Medicare and Medicare Advantage, and that is the Medigap policy. Start shopping 5 months in advance before you enroll in Medicare. So you got your ducks in line. You know what you're going to do. Now, this is hard stuff to do. You don't know, people don't know where to turn. They need some help many times. So the first place to go is your financial advisor. They should be trained and know how to do this. We advise our own clients on how to look at their plans and analyze their options and make decisions. You can also go to a licensed insurance agent that handles Medicare a supplement or Medicare Part C plans, or you can go to a nonprofit independent group called SHIP, State Health Insurance Program. They will guide you.
We put this chart on the screen to show you in one place, and you can also grab this we'll send you a guide after you're done listening here. But essentially, we wanted to outline the different Medicare plans available to you. There's definitions here. What does it cost? And are there any, what do you need to know about it? So again, Part A for Medicare covers your inpatient hospital, your skilled nursing, you're admitted somewhere, A for admitted. And that is zero for a lot of us. You just have to qualify in the same way that you would for Social Security. You have to have worked and paid the taxes for 40 quarters. Part B for Medicare is your doctor visits, your outpatient care, things of that, preventative pap smears. It starts at $164.90 a month, and that is based on your income. So we're going to cover how that changes based on your income in a moment. Most people who do A, B, and D will also get a Medigap policy, and I've color-coded these. So you're going to get either, the 4 grays or the 1 orange.
Nice. I like how you did that.
Okay, we got to make it easy, okay?
Yeah, that's good.
Because it's not. This is the most simple we could make this chart, and still there's a lot on that screen.
Mm-hmm.
So Medigap is that supplemental insurance above and beyond your Part B. Again, depends on the plan that you choose, but on average, $150 a month. I'm just going to skip down to Part D. That's your drug, D for drug coverage. This is going to vary wildly based on the drugs that you take. It can be zero, actually, and then you just pay a lot for your drugs. On average, you're paying about $32 a month for that policy. Super duper important. You can shop that every year, and we're going to talk about that.
And you should.
So the other option here is the Medicare Advantage. This is a Medicare approved plan from a private insurer. It combines them all into one simple and kind of inexpensive package for you. But again, premiums change each year and you're super limited. And you can't go back to B unless you qualify.
Okay, lions, tigers, and bears. Oh my. Let's look at the challenges and pitfalls that you can run into signing up for Medicare and making mistakes. The first one is getting the wrong private insurance. So people have really no idea when they can, should, or have to enroll in different parts of Medicare. They don't have any advisors. HR people at work, they don't know. They're specialists in their own plans. They know nothing about Medicare. And also, health insurance is really product driven. So agents are trying to sell plans to you. Some of them are, some of them are very scrupulous and great. Other ones are a little bit unethical. So you can't really rely on what they're going to say in some cases. And if you get it wrong, the consequences are really terrible. So you can run into coverage gaps where you basically have no insurance at all. You can get stuck with medical bills after the fact. You can get into late enrollment penalties where if you miss a deadline and then you have to go back and sign up, you get permanently penalized for the rest of your life paying higher premiums. So for example, if you delay enrollment in Part B, Medicare Part B, you will have to pay a 10% premium for Part B for the rest of your life. That's a gotcha.
Massive.
That is a big, it's already bad enough,
We'll show you the premium in a second. If you're a high earner.
Yeah, you want to get this right.
Issue number 2 is that our high income families pay more. So your total additional premium for Part B and Part D can vary based on your income. And it starts at $164.90 a month, goes all the way up to $636.90 per person. So if you have a married couple making $250,000 a year, super common scenario in our neighborhood, sure, you are looking at your B and D premium going up to $361 each. And that's just the B and D premium. That does not include your drug plan, your Medigap, all of your copays, everything else that you're paying. So the budget can go high very quickly.
Yeah, it could easily be $500-600 a month per person.
Yep.
In that situation.
I think this is the most common thing that people don't know about when they come into our office. I'd say they go, wait, what a second. I thought it was going to be $160 a month. What? So super important. And again, why you should be thinking about Medicare planning long before you're signing up, because there's things you can do to combat this.
Yeah, we'll talk about those. Okay, the next issue is not understanding the total cost of healthcare. It's a problem because the employers are kind of babying you through this process. They're paying for your medical coverage. They're subsidizing you at the very least. And the premium sharing comes out of your paycheck. You really don't see it. Seems kind of out of sight, out of mind. And also people think that Medicare is free, and that's true. Medicare Part A is free for hospitalization, but not B, C, D, all the other things. So it's not free and it doesn't cover everything. There are certain things that are not even on Medicare's list of coverage, like some long-term care situations. Retirees are just not aware of the total cost of their healthcare when planning for retirement at all. They don't know. So let's look at what those costs are.
Yeah. So where does your healthcare money really go? Well, interestingly, only 39% of what you spend is going into your premiums. 17% you're spending on your drugs. And then 44% is kind of this catch-all, like co-payments, co-insurance, deductibles, doctor visits, that knee brace you randomly had, the KT tape you wasn't in your budget, that vitamin you suddenly needed. So what's interesting about this is a big part of your budget is variable, and that can be really scary.
So let's look at some costs here. The cost of Medicare. So Part A, B, and D, if you're a low cost, if you're a low income type person, your average premiums might be around $300 a month. And that goes across the board. Medicare Part C or the drug plan, $300, and then Medicare A, B, and D could be $300. But if you get into the really high cost areas, Medicare A, B, and D with no Medigap, you could be paying $5,000 a month in total cost each, right?
Each.
And then if you're on Medicare Advantage Part C, you could be paying $4,500 a month. And that's because the maximum out-of-pocket contribution for retirees For in-network coverage in Medicare Part C is $8,300 per retiree, and $12,450 if you're going out of network. That's a lot of money. It's $24,000, $25,000.
Wait a sec. That was my travel budget
for a couple if they're both getting ill. And we're going to get ill when we get old, you know? Yeah.
I think what a lot of people forget to include is things like co-insurance or out-of-pocket expenses. So what you're seeing, you know, on the very high cost is somebody's paying additional out-of-pocket expenses. That's not your premium, but that can really climb. You know, like I wasn't planning on taking my daughter to the ER for a broken arm this year. How do you even begin to budget for that? Right. So having these numbers in your mind as possibilities annually are really important. On average, what do we see? We've got a couple making $250,000. They're 65. They're in relative good health. They don't take a lot of drugs. We're probably budgeting about, I was going to say 800 per person. Kind of our average.
Yeah. That seems fair. Because you got some drugs that, you know, they're going to be costly.
Yeah.
If you get into expensive drugs, that's where you see the bottom right box here, $3,600 a month for Medicare with Medigap, Medicare traditional with Medigap. That's really a factor of the cost of drugs. You can get into like, you know, MS drugs and things like that, cancer drugs that are really pricey. But in 2025, the maximum out of pocket is going to go to $2,000 for drugs. So that's going to cut traditional Medicare with the Medigap way down. Yeah,
it's going to be great.
Way down.
This has been a huge issue for so many people.
It really is. Yeah, it's terrible.
The third issue here is retirement is a really long time. And I think people can forget how long 30 or 40 years are really like, I'm 42. That's my entire life. It's a long time. And so what that means is it's really expensive, more than you think. So when we're doing inflation projections for you in retirement, we're looking at 3%. Healthcare inflation, though, is almost double that, 5.16%. Costs rise as you get older, also due to more health issues. You're healthy today, but something is going to come up. I don't care if you're an ultramarathoner. In fact, if you're an ultramarathoner, it's going to be worse. You're going to need
knees, hips, everything. Yeah.
Come up, you know, and costs are going to go up. And then, you know, medical advancements are amazing. They give us more options, but they also give us more elective costs. You know, you've got weight loss drug is a big thing right now. People are paying for that out of pocket for
$1,000
for the most part. Yeah. Or I go get a body scan for $3,000 and tell me how I'm going to die. Like that's not covered, you know? So as we get more of that, or the latest Botox, I want to get whatever, we're going to spend more. And then custodial care, that's like, you know, nursing, or you need extra help around your home. That's not covered by Medicare. And it's the one that most of us end up needing. In fact, on average, we're going to spend about 4 years getting some kind of care by some kind of skilled professional in our lives. And right now that average is 10,000. I'm going to bet that when this number comes out next year, it's higher, because I'm seeing clients reporting 20,000 for really nice memory care type places right now.
In the Bay Area.
Yes. Thank you.
Cheaper in other places.
Yeah. So, you know, do the math. This can decimate a retirement portfolio. We're looking at almost $500,000 if you didn't plan for it. And it's not going to be covered by Medicare. Now, when you're running out of money at the end of your life, there is Medicaid or Medi-Cal for those of us here in California. The asset limit will be lifted in 2024, so you don't need to worry about that anymore. And the income limit is still very unclear. So we're just going right now with it, you know, for a household of 2, it's about $27,000. Very, very low still. However, you know, you may use some Medi-Cal planning to help get this covered. But again, you may be self-funding this. So adding it to your budget is critical.
Okay, let's talk about Medicare planning gotchas. So the first one is, does your doctor accept Medicare?
Most doctors do accept Medicare, especially for existing patients, but they don't really like it and they don't want a lot of them. So you need to verify in advance that your doctor is going to accept you when you go on to Medicare. Most of them, if you're already there, will keep you when you go on to Medicare. But sometimes this changes. Talk about our friend in San Francisco.
Yeah, I have a friend that I've known my whole life, and I convinced him, he was in Kaiser, and I convinced him to go on traditional Medicare. And he did that, and he found out that no doctors in San Francisco, Oakland, Berkeley were taking Medicare patients, had a prior relationship with them, with that doctor. So he actually had to, limp along to the end of that year and switch back to Medicare Advantage, where he went back on Kaiser. So that's a real thing. That could really happen.
And it's one scenario, in case you haven't noticed, we're not in love with Medicare Advantage for a lot of people, because it can be limiting. But in this case, going away from Kaiser really limited. He had no doctors available in his geographic area. And so it's one where if you love Kaiser, you've always been there, you may wish to
we
stay.
have a workaround for that, right?
Oh, we do. Tell him.
Okay, so the workaround is if you're working and you have coverage and you have Kaiser through your work, switch to a PPO, get some doctors while you're still working, and then when you go on Medicare traditional and Medigap, they'll take you because you're already their patients.
It's kind of silly, but
it's
you got to
a
work
workaround.
with the system you have.
Right.
Yeah. Again, why we're thinking about Medicare months to maybe years in advance. Bottom line, if you transition, you might have to change providers. For some of you, that might be a really big deal. You don't want to do it.
But it's part of the process.
Medicare and HSAs. All right, here's the deal. Once you go on Medicare, you cannot contribute to your health savings account anymore. That's the thing where you get a tax deduction for putting money in. You can invest that money, and then when you pull it out to pay for medical expenses, no tax on any of it. Kind of like a Roth IRA, but it has to be spent on medical. So you can't contribute to that anymore once you enroll in Medicare. Once Social Security starts, Medicare enrollment Part A is automatic, and your HSA contributions need to stop. That trips some people up. If you're not receiving Social Security, you can defer Medicare to keep making HSA contributions if you are covered by an employer or a retiree plan that counts here. You have to have appropriate qualifying coverage in order to defer Medicare and keep making these HSA contributions.
Right.
Why would you want to do that? Who cares? Why would you want to keep making HSA contributions?
Because you get a big tax deduction.
Heck yeah. It's a big deal.
Yeah.
And it all comes out tax-free.
Yep.
We love these things. So what you might do if you're in a scenario where you're 65 and maybe you're still working, right? Or you've got a lot of income coming your way for some reason, and you want to keep making these or keep getting the tax deduction, you might compare. Does it make sense to actually keep paying a high deductible health plan and delay going on to Medicare, like keep it at your employer and keep getting the tax deduction? Maybe you pay a higher premium. In fact, you pay a higher premium, but it might be worth it to you to do that. So just really good planning around HSA. This is where you're going to get your accountant and your financial advisor involved.
Yeah. Okay. The next gotcha, number 3, is Medicare and COBRA. COBRA is not a snake. COBRA is a law that affects employee health benefits through their job. And what you want to do, the bottom line is avoid going on COBRA after you're 65 and you leave your job. Just don't do it. You don't want to take it and defer Medicare because you will miss your special enrollment period to sign up for Medigap. And then you might end up facing gaps in your coverage. COBRA is not considered primary insurance for Medicare. They are primary insurance. And if you don't have Medicare, you don't have any primary insurance. COBRA is going to be secondary. And then you're going to get penalties. And another reason you don't want to do it is COBRA is too expensive typically. It costs like $450 a month on average, when some people, especially in the lower income levels, can get that for $300 a month altogether. So COBRA is just no, don't do it.
Yeah.
After 65.
There you go. Yes. Yeah. Gotcha. Number 5, Medicare and retiree plans. What the heck is that? A retiree plan is a plan that you get from your employer after you are retired. So people my age don't even know what this is because it doesn't exist for us. But if you work for a company, like a big corporation like AT&T in our area has done this for retirees, where they will continue paying your health insurance for you. It's an amazing retirement benefit, but it pays secondary to Medicare. Guess what? You got to be enrolled in Medicare to get that. So people miss this. They think, oh, my AT&T insurance coverage is going to keep covering me. No big deal. Yes, big deal. Because if you have a retiree plan and you're over 65 and you're not enrolled in Medicare, the plan might not pay.
And it's unlikely that your employer is going to tell you to sign up for Medicare.
Yeah, no, they're not. HR is not
They don't
watching you. They're not going to call you when you're 64 and a half and say, oh, by the way, get on it. You're on your own for this. Folks like us are often here, like, oh, here we are. You're 64. Let's do this. But yeah, they're not coming for you. So you have to when you turn 65, you need to sign up for Medicare. Even if you have a retiree plan, you should enroll in parts A and B effective the first of the month you turn 65. You should also ask if you need a drug plan. Really go back to HR and ask, do I need to add a drug plan to this or does it continue to be covered?
Gotcha. Number 6, Medigap guaranteed issues. If you do buy a Medigap policy within 6 months of enrolling in Part B, if you do not buy a Medigap policy within 6 months of enrolling in Part B Medicare, you might be denied a Medigap policy based on your health status, and you may never, ever be able to get one. Never. You can always get a Medicare Advantage plan. Those are easy to qualify. You don't have to qualify for those. But traditional Medicare with Medigap tends to be more stable, has higher premiums, but more stable benefits going from year to year. So a lot of people feel like the traditional Medicare with Medigap is superior.
Yeah. So I think the thing to remember here is you've signed up for your Part A and B. You have 6 months to complete your supplemental insurance. You should just do it all right away, but you got 6 months.
Yeah, I don't know why people would wait. Kind of weird.
Cost potentially,
or
more likely, I think the 6 months was, we should probably go look this up, but I think it was an afterthought because people were forgetting to buy the supplemental insurance because, again, no one knows what the heck is going on or what they're supposed to do here. So they just don't do it.
Yep.
So that's why. So transitioning to Medicare, the time has come. Let's talk about some case studies here. What does it look like for people as they're going through this? I think we all love to, do the like voyeur thing and look into other people's lives. So let's start by talking about our friend Joe here. Joe still works. He is 65, still working for a large employer and covered by a group plan that covers 20 or more employees. 20 or more employees
equals large group.
We're driving the point home for a reason. All right. Must he enroll in Medicare? No, he's not required to. May he enroll in Medicare? Yes, he can. Should he? It depends.
The lawyer answer.
So here's the deal. If you're covered by a group plan that has 20 or more employees, you're not required to switch on to Medicare. But Joe should compare the costs and benefits of his group plan to the Medicare plus supplemental insurance. Because it might be cheaper for him. If he's on kind of a cruddy group plan, we could be paying up to $500-$700 a month. If he switched on to Medicare, if he was not a super high earner, it would never cost that much. He can also enroll in Part A at no cost and get extra hospital coverage. So if he does nothing else, he should enroll in Part A.
Right.
And again, he can enroll in Part B for the extra coverage if he's willing to pay the premiums. Then Medicare serves as supplemental insurance.
All right. Case study number 2.
No, we got to do his considerations. Sorry. What did Joe have to think through before he could make this choice, right? So if you're Joe, if I make this change from my company plan over to Medicare, can I see the doctor I want? Just like our friend in San Francisco, that answer was no for him, and he wouldn't have made the switch. Do I need specialists? Do I have a special sort of disease? What are the monthly costs? How much will my medications cost? What other out-of-pocket costs might you incur based on your usage? So company policies often have like chiropractic or something. If you're really into that, you might not get that same coverage on your Medicare.
Part A and B cover it.
You got chiropractic on yours?
Yep.
You guys got everything. I can't
even. Psychologists.
Yeah, I can't get a therapist.
Yeah.
Okay, your spouse. If you go off of an employer plan, can your spouse stay on it or do they have to switch as well? their consideration. If your spouse is 55, that might be a real issue. Now you can talk about.
All right. Now, case study number 2. Mary decided to stay home. She didn't work, and she's covered by her spouse's group plan that covers 20 or more employees. It's a large group. Must she enroll in Medicare? No. She doesn't have to. May she enroll? Yes, she can. Should she enroll? It depends. She needs to compare the costs and benefits of the group plan that she's on with Medicare plus supplemental insurance. She can enroll for free in Part A to give her extra hospital cost coverage, which she should definitely do. Then she can enroll in Part B for extra coverage if she's willing to pay the additional premiums. And then in that case, Medicare can serve as a supplemental insurance policy for her.
Number 3, we have Ruby. Ruby works for a small company. She is 65 and still working, but she's covered by a group plan that covers fewer than 20 employees. Must she enroll in Medicare? Yes, that's the trigger. Does my group plan have more or fewer than 20 employees? If it's fewer, you got to get on the Medicare. Medicare pays primary to small group plans. So you could keep it, but you also have to go on Medicare. Small plans will sometimes volunteer to pay primary in the absence of Medicare, but they're not obligated to do so, and they could revoke that at any time. So you should not rely on that as your primary coverage. And so here's what could go wrong. We've got Ruby here. No one in HR tells her that now that she's 65, she should also go sign up for Medicare. So she doesn't. She just keeps going to the doctor thinking Medicare is, going to kick in. The plan realizes she's 65 and doesn't realize she has Medicare. And they say, no, we're not paying any of this. And they send her all of the bills. She's stuck with it. So if you're still working, if the employer is small, you must enroll in Medicare.
This is a particularly fraught area here because let's say you're working for Joe the plumber and he's got 3 or 4 employees. He doesn't have an HR department. He has no idea what you should be doing as far as this. It's on you to decide. The risk is gigantic. If you didn't sign up for Medicare and then you ended up having a stroke or a heart attack or got in a car accident or whatever, you could be on the hook for hundreds of thousands. This is a situation where you could go bankrupt. It's like a little window of gap of coverage where you could really lose a lot. So
and with more and more of us working past age 65, this is going to come up a lot.
Yeah. And most employers in the country are small employers.
I will say they should be ready to kick you off their plan because it saves them money.
Yeah, that's true.
Joe the plumber's a moron if he doesn't tell you to do this, but all jokes aside, they just don't know.
Yep.
So now we have case study number 4, Jane. Jane retired young. Lucky you, Jane. She's 65, but she retired at 55 and she retired from AT&T. So she is covered by a retiree health insurance plan. These 10 years have been glorious, but she's 65 now. So must she enroll in Medicare? Yes. A retiree plan, no matter how large your company is not the same as a group health insurance plan for this purpose. They're different. So if you're on a retiree plan, like you're not actively working, you can assume you are, you must enroll in Medicare when you turn 65, regardless of the size of your company. Medicare pays primary to the retiree plans. We've kind of already covered this. She can keep the retiree plan as supplemental insurance, especially if she's not paying for it. Why not? Why? It could be cheaper. It could have better coverage than an Advantage or her Medigap policy. She also, could be afraid of the loss of the retiree coverage. That's just another reason to get on Medicare, right? A lot of companies go out of business, and then who's paying that bill? No one.
Yeah. People just get used to having their employer take care of them. So it feels safe.
Yeah.
They just don't know. Case number 5, Ralph is working until he's age 70. And then he goes on COBRA by his employer. They put him on COBRA.
So here's what will happen to you. On the day you retire, you're handed a package, right? Here's how you get your 401k payment, yada, yada. And they'll give you the COBRA paperwork because they do not know that instead you need to go sign up for Medicare. They don't know. They don't care. It's not in their list of stuff to do.
It's not traditional.
Continue.
Yep. So must Ralph enroll in Medicare? Absolutely. Yes, he must. He must enroll before the end of the 8th month after leaving the employer health plan. If he waits until COBRA ends, which is 18 months in California, he will be outside the Medicare special enrollment period, and then he has to wait until the next general enrollment period to enroll. And during that period of time, which is basically 10 months, he won't have any health insurance at all.
Yikes.
I mean, you know, he won't have primary. COBRA's not going to pay primary. So it's a real challenge. And how are you supposed to know?
I know. This is why you have 8 months, because
Right.
so like, you know, you have 6 months to get your Medigap going. If you accidentally retire over age 65 and go on COBRA, you got 8 months to get your butt back on Medicare.
Yeah.
That's why, because people don't know and they give you some leeway on
Hopefully we're putting the fear of God in you with this. It's really
fear of
fun.
IRS penalties.
Yeah.
That's scarier.
Man.
All right. Should Ralph forego COBRA?
Yes, more than likely, yes. COBRA premiums are higher than Medicare premiums typically. And it's the way to go.
Yep.
More coverage, cheaper price.
All right, it's go time. What do we actually do? Where do I go to push the button to turn this sucker on? I think that's maybe one of the second most common question. The first is, what is this going to cost? Oh my God, there's an income adjustment. The second one is, wait, what do I log into to sign up for this? So the first thing you have to do is choose your start date, which is going to be either the first of the month you retire, the first of the month you turn age 65, or anytime after age 65 if you've been covered by another plan or are still working. Don't forget to cancel your other insurance. This happens a lot. People end up double paying for a couple months. They will prorate and send you a refund, but just cancel your old one when you have your start date for your Medicare policies.
Okay, so the next step is to choose your plan. We've already covered the different options that you have. By now, you've already decided. So it's time to just go in and hit the buttons to enroll.
Yep.
If you're choosing original Medicare, you want to choose the supplemental coverage, Medigap and Part D. These are all done on the Medicare website. You can work with your employer if you're still working, and look at the retiree plan if they offer one. If you're going to go on a Medicare Advantage plan, shop for the specific plan that you want. A lot of times they have like a Kaiser or Blue Cross, Blue Shield, etc. Some resources that are available to you include your financial advisor. And, you know, if they're not up to speed on this, I don't know what to tell you. They should be.
Oh my gosh, this is one of the biggest things that they should be helping you with as you transition into retirement.
Right.
If you pay them a fee and they're not helping you with this, it's a waste of money.
It's a fail. It's a big time fail. Medicare.gov is another place under Medicare.gov/find a plan. Again, licensed Medicare brokers, and SHIP, the State Health Insurance Assistance Program.
Okay, so one thing that we haven't really talked about is dental and vision. You still got to see and eat. And guess what? Not all Medicare policies cover these things, because why would we make it easy on anyone to do anything? So you don't get the coverage.
After all.
You got to go shop for it in individual insurance markets. It's AARP, Aflac, Cigna, United, Delta, on and on and on. You're going to pay about $30 to $75 a month for dental insurance. For vision, you're going to pay $4 to $32 a month. Most people go and get themselves a dental policy. You know, your teeth are going to start falling out at some point.
It's going to happen.
Vision, fewer people get a vision policy. Talk about how you handle your vision.
I mean, you can go to Costco for cheap and get an exam and get glasses and stuff. So, and there are, websites where you can go that are based out of China where you can get glasses for $40, $50. So, vision is something else. And if you have something wrong with your eye, that's covered by your Medicare plan. But if you just want glasses or contacts, that's what vision insurance is for. You could probably self-insure for that.
Good point.
Yeah.
Then you're actually going to go sign up. You have 3 options. You can call them on the phone, you can go online to Medicare.gov, and you can go to your local Social Security office and sign up. You are going to need identification, like a birth certificate, proof you are who you say you are. And I just want to show, this is what it looks like on the Medicare website when you go to sign up. And when you hit that blue apply online button, it's going to open another window and take you to the SSA website. Don't freak out when this happens. You're still in the government site. But I do want you to be aware of what these look like so that you don't end up on a third party, like some private insurance, buying your Medicare with some weird premium, that happens. So you're looking for the URL, medicare.gov, ssa.gov. You got to be on one of those sites. And this is what it looks like.
Step 5 is to find your supplemental Medigap policy and your drug plan. And so you want to either do that or you go on a Medicare Advantage plan. When you are looking for a drug plan specifically, make sure there's a place on the Medicare website where you can enter in all the drugs you take. We strongly urge you to fill those out and tell them what drugs you're taking, because they're going to come back with a premium, a total cost of coverage that includes what the copays and the deductibles are for your drugs. Mm-hmm. And you can compare side by side the drug plans at the pharmacies that you specify. So this is one of the greatest things about the Medicare site. It's fabulous when it comes to comparing drug costs. And every year you should look at this again. So make sure that everything starts, all your coverages start on the first of the month that you're turning 65, or the month that you want it to start if it's later, to avoid penalties.
Step 6, once you are on Medicare, you're going to stop your HSA contributions. There can be no HSA contributions for any month you are enrolled in Medicare. Part A is usually backdated 6 months if the person is over age 65, 65 and a half or older, it gets backdated. So then guess what? You get to go back out any HSA contributions you made after you turned 65, but before you signed up for Medicare. This gets people because they don't know about that. Excess contributions can be backed out anytime before your tax filing deadline. So let's say you turn 65 in November, you sign up for Medicare right then at age 65. And then you made a HSA contribution in December. You got to take that last HSA contribution out. You have until your tax filing deadline to do that. So for most of us, it would be, April 15th of the following year. No big deal. You just take it out and put it in another account. Super fun.
Sorry.
No, come on. We got to talk about the loophole. We can't skip this. It's super important. So if one spouse is still working and on a high deductible, they don't even have to be working. If you're on a high deductible health plan and not on Medicare, that spouse can still make the full family HSA contribution plus their own catch-up contribution. So the family HSA contribution in 23 is $7,750. Plus, if they're over 50, they can make their catch-up contribution. So there might be a scenario where we've got one spouse going on to Medicare, but another one is still on a high deductible plan. And it might make sense, as we were talking about before, keep that one spouse on the high plan so you can keep making these contributions. You could do some really cool planning with your advisors on that.
But your spouse just can't make your HSA catch-up contribution. Otherwise, you've contributed too much.
Yeah.
Step 7, this appeal the IRMA means the IRMA relates to the excess charge that Medicare pays you if you have higher incomes than the bare bones income level that they specify. And sometimes what Medicare does is it goes back 2 years, your income 2 years ago, to decide what your premiums are going to be for that year. So for example, we're going into 2024 right now. They're looking at what your income was in 2022 to tell you what you're going to pay for premiums in 24. Well, what if you retired in 2023? And now you're on a much lower income? There's a workaround for that. It's called appealing the IRMA. You use a form SSA 44, which you can get on the web, and you tell them how much you anticipate earning in 2024, the next year when you're off work. And then you take that form and you send it in to the Social Security office, or you can bring it in also. And you also have to show a life-changing event that qualifies you to have a lower premium and not be stuck with the premium, the income 2 years ago. Those life-changing events include, they're listed here on the screen: marriage or divorce, death of your spouse, work stoppage, which means retiring, work reduction, same thing. It could be going from part-time to or full-time to part-time, loss of income producing property. Basically, that means you have a rental or an oil well or something, that you don't have anymore. And then that'll qualify you. Loss of a pension, income from pension, or employer settlement payment. All of these are what are called life-changing events. You put those on the SSA form, send it in, and you most likely will get a reduction in your premiums. We do it all the time for our clients, and it saves them thousands of dollars a year each in premiums. So it could be, $4,000, $5,000, $6,000 in savings.
It's massive.
It's really big. And so again, talk to your advisor. They should be advising you about this.
I'll tell you one thing that's not a life-changing event, because everybody asks us. That is, if you had a capital gain on a past tax return, something like you sold your business or you sold your home, your primary residence or something like that, and you had a massive income for that year, those are not considered life-changing events that you can then get your you're going to have to pay the higher premium. This happens a lot when a couple sells their residence and they owe a big capital gain on their residence or a business. So
or
sorry, you can't do it for that.
Stock portfolio gains or something like that. Yeah.
Step 8, you're going to monitor and manage once you sign up. Like we talked about, drug plans and advantage plans change every year. So every open enrollment period right now, you are going to shop those plans. You get all your drugs out and you're going to type them in and you're going to shop it. And we have seen people save thousands just by switching onto a new drug plan. Checking for higher premiums, reduced benefits, changes in your provider network. They'll sneak those in on you. You might also look at new markets. It could save you some money. You might need to appeal the IRMA again if necessary. Remember, it goes back 2 years. So, you may have to tell them again, hey, by the way, I still have this lower income this year because of this event that happened 2 years ago.
Right.
It's kind of idiotic, but you got to do it. And then continuing regular tax management. Obviously, no one wants to overpay their taxes, but throughout your retirement, it is so critical because you could see your monthly budget, for this, like it could go up $300-$400 a month overnight because you accidentally had a large capital gain. So make sure that your advisors are managing your taxable income for you with this in mind.
And if you go $1 over the threshold, you could pay thousands more.
It's a cliff.
So yeah, it's a cliff. So you could basically, if there's a way to roll back and have a little bit less income, if you're close, this is where the magic happens with a good advisor. We'll just sell this at a loss that you have, and now all of a sudden you have less income.
Here's an example. We have a client that is right on the board. I mean, they're like 3,000 over under. They had a bunch of money in a Bank of America savings account. And so the advice that we would normally give is get that at least over into Ally earning, 4.5%. But that would have added $20,000 a year to their income. So even though it's a good black and white financial choice, it was going to hose them on their Medicare premiums because of that cliff. So instead, we looked at muni bonds, which there's no tax to them on that. So they continue to get the higher interest on their assets without having to increase their taxable income. And then we harvested some losses that were already in the portfolio. So this year, they're not going to hit that IRMA bracket.
Yeah. You can also do it like with a CD that only pays at the end of the year, the interest, or the end of 2 years or something like that. So there's ways you can get around it. You should look at that.
Use us. Wow. We've gone over so much today.
Yeah. We're just going to kind of go through that. We showed you the who, what, when, where, and why of Medicare and how to enroll, how to combat the IRMA, the dreaded IRMA additions to your premiums for Medicare. We shared the penalties and also how to avoid the penalties for late enrollment. And we explained what to do if you're over 65, under 65, or after 65. And when we discussed how to handle private insurance, whether you should keep it or not, based on the different kinds of sources of the plan.
Yes. We have a Medicare guide. If you would like a copy of it, please let us know. You can click on the link on your screen to get it. Let's take some questions.
Yep. You can type in the questions in the chat feature.
The first question that came through here is, what happens if I don't sign up for Medicare during my initial enrollment period? The short answer is you get penalized, but let me talk a little bit about the different enrollment periods because you need to know what they are in order to hit those deadlines properly. And so it's a little bit of an alphabet soup again. The first is the initial enrollment period, and this is around your birthday. It starts 3 months prior to turning 65 and ends 3 months after. So there's basically a 6-month window in which you can go and kind of standard sign up for Medicare. Then we have something called the annual enrollment period. This is right now, October 15th through December 2nd each year. This is when you can switch plans and enroll in or switch Medicare drug plans. So for people who already are on Medicare, this annual period is about changing things. Then we have something called the open enrollment period. Don't confuse this with the annual or the initial. The open enrollment period is January 1st through March 31st. This is when you can enroll in Medicare for the first time if you missed it on your birthday. You can change from Medicare Advantage from one to another. You can also, if you qualify, change from Medicare Advantage to original Medicare. The final is the special enrollment period. Now, these are times when you can enroll in Medicare outside of the other enrollment periods, kind of indicated in the name, it's special. It's generally triggered by an event like losing other coverage, such as an employer plan, you or your spouse retires. And in that time, you would be in your special enrollment period, which lasts 8 months from the triggering event. And now there are some penalties for not signing up.
Yeah, because it is the government. So if you are late in signing up for your Medicare Part A and B, like you go past 65 or you don't sign up for it when you retired, the penalty is, as we talked about earlier, it's 10% per year that you don't sign up. So if you don't do it for 3 years, the penalty is going to be 30%. So, and then that's permanent. It goes for the rest of your life. Also on the drug plan, the penalty is 1% for every month that you do not sign up for it. So if you waited 6 months to sign up when you should have signed up earlier, you pay 6% more for the rest of your life, 12 months, 12%, 24 months, etc. So those are pretty steep penalties. You want to definitely try to avoid those.
Absolutely. Okay. Next question.
We have a question about end-stage renal disease. So basically, this is if you go on dialysis at any age, you can qualify for Medicare and you should sign up. So if you know, people don't know this. I mean, they really don't. Like if you have a spouse that's not working or somebody, whatever, you should definitely go on Medicare because even if you have health insurance through your job, you will, or your spouse does, you're still going to have a ton of copays and all that stuff. And you can get rid of all that by going right straight to Medicare for sure. Yeah.
What else do we have here?
Another question about the, yeah, there you go.
Did I hear you say you should always sign up for Medicare Part A when I turn 65? Yes, you did hear that right. Thanks for asking. I love that we get to drive this point home, actually. Especially Part A is free to everyone. So the day you turn 65, or as we said, 5 months, 3 months before, go ahead and sign up. It's free to you. And it basically acts as supplemental coverage, even if you're still covered by your own employer or retiree plan or your spouse's coverage. Go ahead and sign up.
Right.
Anything to add on that?
Right. And one more question that was asked about, there was a question about getting doctors to be on the plan and take you when you're on Medicare. And we mentioned earlier, that's very hard. Sometimes if we really want you to call the doctor specifically before you retire and go on Medicare and ask if they will accept you, because you can go on the Medicare website and they'll have lists of doctors and the networks and things. And it says, yes, they're accepting Medicare. And you think, okay, I've checked that box. I'm good. But trust me, it's not good because they won't accept you because they get like $30 to treat you and where they normally get 150 or something. So, you really have to do your homework and make sure, because you do not want to end up holding an empty bag and not be able to get coverage or, doctors to treat you.
Yikes.
That's really, really a problem. So you got to be smarter than the average bear and beat the system.
Yep, you sure do. Well, it looks like that's all the questions, and we're also out of time for today.
Thank you so much for joining us with this webinar. We hope it was valuable to you.
If you have questions for us, please feel free to reach out. It's a complicated topic and we'd be happy to help you. You can reach out to us at info@aplaceofpossibility.com. We'd also love to meet with you, talk a little bit about your particular situation and how we can help. So you can schedule a complimentary meeting with us by clicking on the link to our calendar. Just find a time that works for you.
And one more thing, we are going to be, this is just one of our series of webinars. We are going to be, the next one we're going to be doing is on Social Security claiming strategies. And we're also going to do one on showing you exactly how to change your Medicare drug plan on the using the Medicare website. And so we'd love to have any suggestions you have about future webinar topics. Just let us know and we will be happy to include those. And don't forget our Place of Possibility podcasts. If you're not catching those every 2 weeks, you can get those on any streaming service or our website, placeofpossibility.com. Thanks for joining us. We hope to see you again soon in another webinar.